I'm going to go ahead and play the next segment. Alrighty, I'll see you all soon.
Good day. Thank you for the opportunity to share a new tool with you, a tool for persons like me with autoimmunity. To explain how it came into being, I'll share a bit of my story with you. I am Dr. Charmaine Jones, a retired family physician who practiced palliative hospice medicine for 35 years. I'm also a mother, a grandmother, a sister, a partner, and I'm a woman living with autoimmune arthritis since 2015. I've always been busy. During my career, I've won many awards and accolades for my pioneering work in palliative medicine. I was also physically strong and active. Long distance cycling was our thing. Cross Canada in 1994 and around the globe cycling in 54 countries in the year 2000. I felt robust and well until 2015. I found myself on the other side of the stretcher, or actually on the stretcher, so to speak. I was a confused, vulnerable woman looking for answers. After months of an increasingly swollen knee accompanied by night sweats, I landed in an emergency ward in a foreign country. MRIs and surgery for debridement and biopsies led to a misdiagnosis of a septic knee, a potentially serious joint-destroying infection. After 2 weeks of intravenous strong antibiotics, and there was no growth showing up on any of the biopsy samples, it became obvious that this was not an infection after all. Meanwhile, every joint was now swollen. It was really hard to look after myself. I couldn't chew, I couldn't turn my neck, I could barely walk, and I was diagnosed with rheumatoid factor negative inflammatory arthritis, or RA, rheumatoid arthritis, an autoimmune condition. After I got over my initial shock, which fluctuated with denial, I started looking for answers and for support. I took my prescribed medications, but what could I do to help myself? I discovered Dragon Claw. Now that's an unusual name for a registered Australian charity dedicated to improving the quality of life for autoimmune sufferers and their companions through a better understanding of how to manage their condition. This is a patient-led organization for patients like me. I read on to understand the unusual name. The originator felt he was living with an internal dragon which would sporadically awaken, clawing and spewing fire into his joints. An apt description of my arthritis flares. He wanted to learn what he might do to help himself the 350 odd days a year when he didn't see a health professional, and he wanted to share what he was learning. And I also came across the Canadian Arthritis Patient Alliance, or CAPA, another by patients for patient organization, helping people living with arthritis find their voice. Patients also sharing what they learned along the way. In the spring of 2020, Dragonclaw initiated Dragon Talks to help with the isolation imposed by the pandemic. We are into our third year of weekly meetings now. I co-facilitate these meetings. We are an open group. On this capture, there are participants from Canada, Australia, and the United States. We all participate as we are able. The what and the why of Dragon Talks. We are a weekly online support group on Zoom for people with autoimmune and their companions. They're facilitated by volunteers with lived experience. We enable self-care through education and peer support. It can be difficult for people with chronic disease to understand their illness, to navigate the healthcare system, and to coordinate their care through episodic visits with multiple providers. Dragon Talks provides education on our 5 pillars of health, drawing on the expertise of professional experts who have freely given their time. For example, Dr. Paula Harvey, shown here with her team, she's the co-director of the Rheum Cardio Clinic at Women's College Hospital in Toronto, Canada. She explained that our risk of having a cardiac event is doubled simply by having an autoimmune disease. Hence the importance of regular checks of our blood pressure, weight, lipids, and exercise program. This was news to many of us and important. Many of us are not aware of the risks inherent with autoimmunity, nor the potential adverse effects of our medications. Or in short, in the case of RA, rheumatoid arthritis may affect more than your joints. Well, how big a problem is this? How many people are there with autoimmunity? Well, sadly, autoimmunity is on the rise. The best guess the current research literature has is that an estimated 4% of the world's population has at least one autoimmune disease. And once you have one, there is risk of developing another. In the USA, the number may be closer to 8%, and these rates are not static. Experts say they've been increasing for decades. Well, is there a shortage of healthcare providers? In the case of arthritis, the current estimate is that Australia is short of 302 adult rheumatologists. And people with autoimmune disease often require more than one specialist. And the map here of Canada shows the number of adult rheumatologists needed in each province and territory to meet an international standard. And I suspect we are all too aware of the shortage of primary care providers. In Canada, 4.6 million people do not have a regular primary care provider. Another recent article suggests that it's actually 7 million Canadians that are missing a regular primary care provider. And often there is, or we feel there is, a time crunch in our appointments. So this can put us, the patient, in a very vulnerable position. So this is what led us to wonder if we might provide a tool to help us become active partners in our care, to help monitor our overall health, to help coordinate our care between multiple providers. After all, patient engagement is a necessity for optimal health. So, working with patients from both organizations, Dragonclaw and CAPA, Know Your Numbers was born. This is a tool for patients, for us, a tool to explain simply in layman's terms what the tests measure and to help us keep track. This tool would help with sharing information between our healthcare providers. We would have a record of dates of our last DEXA scan or eye exam, etc. Here's the first page of Know Your Numbers. This is a list of and simple explanation of commonly monitored blood work. For example, you've probably heard of a CBC. Now, what is that? It's a complete blood count. The hemoglobin are the red blood cells that carry the oxygen around your body. The WBC are white blood cells. Those are infection fighters. And platelets, clotting agents. Or another common one when you have an autoimmune condition is your CRP or ESR. What's that? Well, CRP stands for C-reactive protein, and ESR stands for erythrocyte sedimentation rate. Now, those help measure the inflammation in our body. In some autoimmune diseases, these are a very good way to measure if our inflammation is truly under good control. So you'll go on, and there's the list of other blood work components that are commonly followed when you have an autoimmune condition. But the next page measures other screening tests besides blood work that are important. For example, blood pressure. Now, blood pressure, along with a lot of these other investigations, can pick up silent progression that will not bother you until quite far along. So blood pressure can rise with autoimmune conditions and with some of our autoimmune medications. You probably wouldn't have any symptoms, but over time, high blood pressure will alter and change some of your organs. And it's important to control your blood pressure. There's bone mineral density, also known as DEXA scans. Some of our medications or our autoimmune disease or inactivity will increase bone loss. And again, you will not have any symptoms until you have a fracture. So these are very important to monitor. Same with your eye exams. You don't want to wait until you have severe damage in your eyes. You want to keep a check on that. Lots of autoimmune diseases will affect parts of our eyes. So there's the rest of that list for you. And the next page is a checklist. And I would suggest that you print this off and date it at the top. And this way you can keep track of when you had the tests and you put down the result. And over time, you will able to perhaps make a chart and see if there are trends that you need to be aware of in some of your results. So this is the new tool developed by patients for patients, an aid for us to be active participants in our healthcare and to improve collaboration between our multiple healthcare providers. Now, interestingly, we have some early feedback from a group of users. We've heard that when they use the tool, it has actually changed the doctor-patient relationship towards a richer shared decision-making model. Well, this is an unexpected outcome, but it sure is a welcome one. So if you're a healthcare provider, please share this with your patients. If you belong to a patient group, please share this with your other members. Let's do what we can together to improve our health. So here are the contact websites and emails for our organizations. The tool is found on the website, easy to access, download, and print off. We would welcome feedback, and also we would welcome other suggestions you might have for improving our healthcare. Membership in our organizations is free, and we certainly welcome new members. If you're interested in Dragon Talks, please send along an email to info@dragonclaw.net. Together, we can be strong. Thank you for your time.
Thank you so much to Charmaine from Dragonclaw and to those at CAPA for creating this amazing tool for us to be able to track our different blood tests that we may be trying to track. For a lot of us, blood work can be very important. For a lot of us, blood work may not even show up to see, basically, to show what we are experiencing. So, this is a very good tool in order for us to be able to track what we need to and be able to have that data readily available for the physicians that are trying to help us. And so I just wanted to shout out to Dragon Claw. We at AI Arthritis do not have support groups. So we do like to elevate those who do have support groups. And so Dragonclaw is one of them. They are predominantly based in Australia and in Canada, but do offer virtual support for the general autoimmune and autoinflammatory community. They actually have a lupus series that is going to be going live this month as well.